Therapist versus psychologist. What are the differences? Gone are the days when there was a misconception that someone who has gone mad or has a severe mental breakdown needs to consult a psychologist or visit a therapist. In this digital world, where everyone is running a marathon whose finishing line never comes, we often feel a sheer feeling of emptiness in ourselves. But one has to be precisely clear about the reasons whether to consult a psychologist or a therapist. These two terms are usually considered as a synonym to each other. However, there exists a clear difference between them. Knowing all about therapist versus psychologist would be helpful in a situation where someone needs counseling. Difference between a therapist and a psychologist. A psychologist evaluates, diagnoses, treats and studies precisely about human behavior both under normal and abnormal mental states. In order to become a psychologist, a person needs to complete a degree in psychology, but experts of other behavioral professions such as psychiatrists and counselors may also be permitted to observe, interpret and record the behavior of individuals. On the other hand, a therapist is a person who is trained in treating the disorder without using methods like drugs or surgery. They utilize methods to treat a person using some physical methods such as exercise and heat treatments to overcome their physical limitations, or psychological methods like talking about those problems to help patients overcome those psychological issues. A checklist may help to understand the difference more clearly. Psychologist versus therapist checklist. A psychologist has a professional degree in order to practice psychology, while a therapist can be a psychologist, social worker, career counselor, or marriage counselor. Both aim to help and guide patients. A psychologist works alongside a psychiatrist to prescribe some medical treatment apart from speech therapy. In contrast, a therapist works in most of the cases individually using various techniques of therapy. However, there is a huge number of professions which fall under the category of therapy. For instance, psychoanalysts, marriage and career counselors, social workers and psychotherapists, and many other professionals fall under the umbrella of therapy. Similarly, when we talk about therapist versus psychologists, it should be kept in mind that there are hundreds of branches of psychology, but clinical and counseling psychology are the two branches which are within the context of therapist versus psychologist. Hence, to narrow down the concept, now we need to understand psychiatrist versus psychologist versus therapist. What is a clinical psychologist? A clinical psychologist is an expert who uses psychology for the purpose of diagnosing, mitigating, and alleviating dysfunctions related to psychology. It is to be noted that a clinical psychologist can only utilize talk therapy as a treatment. In order to take medicine, a patient has to consult a psychiatrist. What is a psychotherapist? Keeping in mind the psychotherapist definition, this is a person who is trained to help people with a variety of mental illness like depression, anxiety, etc., and cope with emotional difficulties like loss of a loved one or the impact of trauma, etc., and provide family therapy, marriage counseling and cognitive behavioral therapy. What is a psychologist? The primary focus of a counseling psychologist is to facilitate emotional, social, personal, developmental, and organizational concerns. Their practice includes helping people in distress find relief from anxiety, and improve their well-being both at their personal and professional grounds. In this era, mental health is equivalently important as a person's physical health. Therefore, a psychologist or a therapist can help you to cope with the challenges you are facing on a mental level in your daily lives. For more details, click on the link below the video.